Pulmonary arterial hypertension, or PAH, is a condition of high blood pressure in your lungs, specifically in the blood vessels that carry blood to your lungs. But what does that really mean? Normally, blood flows easily through the pulmonary arteries from the heart to the lungs, where it picks up oxygen. But in PAH, these blood vessels become narrower and stiffer. This makes it harder for blood to flow through the lungs, and the heart has to work much harder to push blood through. As the heart works harder, it can become strained. This leads to symptoms like shortness of breath, fatigue, and dizziness. So how do we treat PAH? The main goal is to reduce the pressure in the pulmonary arteries, making it easier for the heart to pump blood through the lungs. Current treatments for PAH focus on relaxing and opening the pulmonary arteries, which helps blood flow more easily. Current treatments for PAH affect various cell pathways. Pathways are like instructions inside our cells that tell them what to do, like what chemicals to produce, how fast to multiply, or when to stop. In PAH, these pathways can get out of balance. Some cells produce too much or too little of various chemicals. Some cells keep multiplying when they shouldn't, and others don't die off when they should. That's why researchers are focusing on these pathways. By understanding how they work, they hope to find new ways to control cell growth and multiplication, to open the pulmonary arteries, and to help the lungs and heart work better. In some patients with PAH, there is lower function of a pathway which normally controls cell growth and multiplication in the pulmonary arteries. This pathway is known as BMPR2 signaling. A competing pathway, known as the activin signaling pathway, takes over and causes the growth and multiplication of too many cells in the pulmonary arteries. Sotatercept is the new drug that blocks this activin signaling pathway. It binds the activins, preventing the growth and multiplication of these extra cells that narrow the pulmonary arteries. Sotatercept has already been shown to lower the pressure in the pulmonary arteries and improve symptoms for many people with PAH. In one study, after 24 weeks of treatment with Sotatercept, in addition to their other treatments, people's 6-minute walk distance increased by an average of about 40 meters, and they had an 84% lower risk of death or of their PAH progressing. Thanks to ongoing research, new treatments like Sotatercept offer more hope for people with PAH. And as scientists continue to study how the body's pathways work, we can expect even more breakthroughs in the future. With better treatments, we can help more people with PAH live longer and better lives.